And then Rachel had asked if it was possible to use a brain sheet in the emergency room. So she's doing a preceptorship in a level one trauma center and wants to be able to keep everything straight. And I totally get that, Rachel. So, yes, you can use something like a brain sheet in the ER, but it's not going to be anything like what you've seen, us use in med surge or tele or the ICU. It's going to be, here's what I would do. I would take, I would make a template, okay? And I would probably make it so that each piece of paper is like a quarter. So you could do 4 on one piece of paper and just fold it around, and I would seriously just put the very basics on there, like their name, okay? Um, their chief complaint, why are they here? And then any significant medical history, not their entire life story, but if they have heart stents or heart failure or are, type 2 diabetic, I would put that on there. Significant medical history, their vital signs, and any significant findings, labs that were sent, kind of the plan, big things that you did in the ER, so that when you take the patient now, you're going to take either they're going to be discharged or they're going to go and be admitted to the floor of the ICU so that you have something to reference when you're giving report. So those are like the basics for ER. And I would just have a bunch of those because you're going to have so many patients over the course of a day, and just jot those things down. Don't make it super complicated. Don't make it super rigid with check boxes and things because there's going to be so many different types of situations. It's not really going to fit into a mold. Like in a very controlled environment like the ICU, I can kind of predict the information that I need and make my report sheet very detailed in that way. But in the ER, it's anything goes, right? So I would just keep it super simple with those key things. So Rachel, I don't know if you're here today. I don't think you are, but I hope that that answered your question. Okay. And